Hi, everybody. My name is Jessica Davis, and I'm the Marketing and Communications Manager for Fear Free. Thank you for joining us for Bad Breath is a Really Big Deal, brought to you by Bark. Presenting today is practicing board-certified veterinary dentist Dr. Jan Bellows. If you have any questions during the webinar, please be sure to enter them in the Q&A box. We will have a Q&A session at the end of the presentation. We're so excited to have Dr. Bellows here with us today. So on that note, Dr. Bellows, take it away.
Oh, thank you so much, Jessica. There's probably not a more important disease syndrome that animals go through than bad, smelly breath. And doggy breath just doesn't have to be doggy breath. It can smell like roses and it should smell like roses. So by the end of this short presentation, hopefully you'll get a really good feeling on what causes bad breath in animals and more importantly, what you can do on any level to make it a fun, fear-free process. So with bad breath, needs to be prevented. If you flip the lips of your patients or your own animals and you don't see all the gum line looking like this, then there's a reason for it. This doesn't happen all by itself. If it's like this with bacteria and debris that's built up underneath the gum line, that's a bad problem. And that's certainly something that you can prevent. And so many of our clients feel guilty that they don't prevent it. So let's talk about what the issue is. Stage 0, or what everything should look like in all animals at any age, are nice, healthy gum tissue. Where the gum tissue just lies right against the tooth, there are little micro capillaries going back and forth, putting fluids that are always exchanging any of the bacteria that builds up. This is a very healthy tooth and gum tissue. There are 4 stages of gum disease. Stage 1 is gingivitis, and all of these are caused by plaque. And you'll soon learn that plaque builds up every 12 hours on the gum tissue. And when plaque becomes mineralized, it becomes rough, and that's called tartar, or it's also called calculus. The problem with that is that on top of this rough tissue, as compared to, when you go to your human dentist and you get the teeth cleaned and polished and you take your tongue and you go over your teeth, they're so smooth because plaque wouldn't want to build on there. But could you imagine if it got plaque and calculus got this rough, which it does in humans even, that they don't brush their own teeth? The plaque then stimulates and irritates the gums. And this is called gingivitis. Gingivitis is stage 1 periodontal disease. There's inflammation, but fortunately, there's no support loss. Stage 2, there's support loss. So right in this area where it gets all inflamed, if you put a periodontal probe right up this area, it would bleed and it'll be inflamed. And worse than that, there would be loss of attachment between the tooth and the bone. And this is all caused by plaque, which is preventable. That's the big go home on this presentation. It's all preventable. Stage 3, there's more bone loss. And it's actually less than half of the tooth is still there. So, or greater than half is still there, but it's still at that half point. And in stage 3 disease, when you have severe gingival recession, the treatment of choice is taking out the tooth. In this situation, we took out the tooth, which is a shame, but a lot of dogs lose their teeth when they get older because no one has prevented it. Stage 4 disease is greater than 50% support loss. And you can see just the horrible gingival recession and how the plaque is building up in the periodontal pocket. And plaque is just loads of bacteria that are breeding and logarithmically replicating. So you have more bacteria and then more inflammation. And it just doesn't sit there. It just goes deeper. It goes into the liver, to the kidneys, to the brain. So this is all something that unfortunately can be prevented, and virtually nobody is preventing it because toothbrushing is just so hard. All right, what clients need to be convinced is that their animal has disease, because most clients feel, smell bad breath, and they understand that it's doggy breath. It's a dog, and he's got to have bad breath, but that's not true. So we have to bring what's below the gum line out so clients can see it. And this is either done with an iFi card, or we use an iPad that we take a picture and blow it up to show the clients so they can see, or cell phones. There are many brochures that you can get. This one is from Verbeck. You just call them and they'll send you these brochures for free that will tell you the stages of disease, so clients can actually compare the brochure to the image itself. And this image is taken with a camera and wirelessly transmitted to the TV in the room. So it kind of takes what's underneath the gum line out and broadcast on the television. Another way of seeing what's going on below the gum line is using a blue light. This one comes from Dectra. Again, you call them and they'll send you one in the exam room. Because plaque and calculus fluoresces, you can show the client, even though it doesn't look that bad, it really is pretty bad. There's a lot of debris that is sticking to those teeth that are abnormal. So the attack is a procedure called the copat. Co is comprehensive oral. P is prevention. And prevention is number one, because if you prevent the problem and you keep on preventing it, then you're going to have less to assess and treat. But if you put prevention at the end, what we used to do is call this oral ATP, where prevention was at the end. Our feeling was, well, prevention is something that we do, but it's not as important as the other parts. All three of these parts, the prevention, the assessment, and the treatment, are equally important. It's like a tripod. So the prevention is number one. And you sit down with the client and you go over exactly what are they willing to do. Some clients are willing to brush their pet's teeth twice a day, or in a cat, use a Q-tip dipped in tuna juice on their teeth twice a day. And that works great. But sometimes clients say they will, but they don't, because toothbrushing is really, really a hassle. So most people don't do that. So you have to figure out with the client, what are they willing to do? And on the other side of that is, what is the animal willing to accept? Some people have sharks that the animal will not let them close to the mouth, will not let them put their fingers in their mouth, that it wouldn't be safe. So those clients have to focus on chews, water additives, different dental diets. It kind of all adds in. So you need to speak to the client, and you need to understand what they're willing to do. The second part is the assessment. And this is the assessment of the animal before anesthesia, what their dental history is, what their medical history is, what their present medical history is, laboratory tests, chest x-rays on all the ones, EKG, blood pressure, urine, all that's part of the assessment. And then when they're under anesthesia, the very important part is a tooth by tooth assessment. Dogs have 42 little patients in their mouth, cats have 30, and it's so important to evaluate each tooth to find out, is that tooth in great shape or kind of okay? Can it be treated? Is it functional, not functional? Does it need to come out? And then once you chart all these 42 patients, because each one will have different therapies and some won't have any at all, but you have to tell the client, okay, this is what we saw. We evaluated your pet's mouth and there's 7 teeth that have problems. This is what we can do. 4 of them need to come out, 3 of them can be treated. Clients need to have that discussion before you do the treatment. And sometimes it's the same day or the same anesthetic procedure. Other times you wake them up and then you discuss what you found when you send them home and set up an appointment later. And then the treatment. So the treatment's an important part because you just don't want to clean them out, take care of the bad breath, and send them home because most of the bad breath in animals is coming from pockets. And these pockets are like pockets in your pants. If you put breakfast in your pants and lunch in your pants and dinner and decided not to take the food out of your pant pocket and wear the same pants for 3 months, you can imagine your leg would probably rot off for a good reason. And that's why every pocket needs to be treated. Every tooth that has periodontal disease needs some sort of treatment. And again, if you start with prevention at the beginning, you're just so way ahead of the game. All right, treat the treatable. So here's what we do with cases of periodontal disease. In stage 1, where there isn't any bone loss, all we need to do is clean the teeth, polish them, and we apply a sealant on the tooth itself. And what the sealant does is go underneath the gum line. It goes way into this area, and it helps to prevent plaque buildup. All these things that we're going to talk about in prevention, each one helps a little. There is none of them that is going to cure the whole periodontal disease. There's no like magic wand that you put on the dog and say, yep, you won't have periodontal disease. It doesn't work like that. Stage 2 disease, especially where you have bleeding on probing, you start to probe and you see some bleeding, that means that area is inflamed because you'll probe, like say this area, and that's not bleeding, but why is that bleeding? That's inflamed for a reason. And in that, we usually air dry it after we clean it and then inject a product called Clinderol underneath it. And what that does is decrease the bacterial load in that area, and it turns that area into better healthy tissue, and it decreases the pocket depth. Again, it doesn't cure the animal from periodontal disease. Once you've gone past stage 1 disease, then stage 2, 3, and 4 are progressive. So it's going to get worse. But doing all these treatments will decrease, and the home care will decrease the progression of disease. Stage 3 disease, where you take an x-ray and you see about 50%, a little bit less than 50% of support loss, and there's a hole in the middle of the tooth called the furcation exposure. Food and debris are going to build here. So it's best to just take out this tooth. That's stage 3 disease. And stage 4 disease, it gets really bad. In this situation, this is a Yorkshire Terrier that got so bad. This is the middle slide is the right side. The periodontal disease went right through the bottom of the jaw and fractured the jaw. The left side did similar. So this dog, I had to take out the front part of its jaw and its tongue stuck out. But the dog was happy that it was out of pain because he was walking around with 2 fractured jaws and was eating the next day. So the animals tend to do really well once you give them great treatment. But it's a shame this dog had to have every tooth taken out and the front part of his lower jaw. Also, stage 4 disease, especially in dachshunds, the tooth falls out and there's a hole that goes from the oral cavity into the nasal cavity called an oronasal fistula. And this comes from just severe periodontal disease. So this is one that needs surgery. There's the hole. And we're able to do some flap surgery to cover the hole. So that's the hole. This is the area of surgery. This is what the surgery would look like. and this is all closed, and it wound up healing fine. Okay, so now you know what causes periodontal disease, plaque, and tartar, and we're going to talk about things to do to prevent it. And as I said, it needs to be specific to the patient. You need to start early. The dental sealants that we use are Oravet and Sanos, and toothbrushing, recommend it every day. However, don't feel guilty if you don't do it or your clients don't do it because they just don't do it. But then there's wipes, Q-tips, diets, water additives, and shoes. All right, let's talk about the sealants. There are two sealants that are used in veterinary medicine. One is called Oravet, the other one is called Sanos. And I did the study for the Oravet in cats to show that it works. The study in dogs, I mean, there were two actual studies that showed a really nice decrease in plaque and calculus. But that being said, even though it's a really good product, it is applied at the time of anesthesia and then applied every week. And the problem there is that most people won't remember to apply it every week to the dried teeth. It's one of these hassles, and the dog really doesn't appreciate it either. So even though it's a great product, I know it works, unless the client is going to provide the weekly application, which most people unfortunately won't. It's not something that winds up working in practices. So what can clients do at home, or what do clients do at home? And at present, the client actions are treats very aggressively. They feel that food helps. Some clients do brush. The veterinarian just about beat out the groomer, and none is a pretty high point too. So treats are number one that clients choose to control oral disease. And clients unfortunately want different things than the veterinarians feel are evidence-based that really does work. And what the clients are looking for is a very pleasing bag that the treats come in. They want to see on there that it cleans teeth and freshens breath. They'd love to have all natural, made in USA, and they fight tartar and plaque. Now, this is important to understand that virtually anything can be written on a bag without evidence-based research to back it up. The FDA does not aggressively go against any company that just writes these things on bags. They aggressively go after companies that claim disease control. So if it says controls periodontal disease, cures gingivitis, that would be a problem. But if they say whitens teeth and freshens breath, that would not be an issue that they would go after. So I went to several pet stores, and I wanted to see what they were selling to clients. And this is Texas Toothpicks, a nutritious, delicious way to keep the teeth and gums clean. Now, imagine yourself as a client and just looking at these things and say, yeah, that makes good sense. Vitabong visit biscuit, and cleans teeth and freshens breath. And this one helps control tartar. I mean, the veterinarian says it has tartar, and this Temptations helps control tartar. Why not buy it? Unfortunately, the products just don't have the research behind them. This is a brushless toothpaste. Now your pets can help care for their own teeth. Ends hand brushing, wipes, sprays, gels, paste, and jumpy pets. Helps reduce plaque, tartar, bad breath, and stained teeth. I actually contacted this company and I asked them what research that they have that they've actually done studies to make sure these claims are based in peer-reviewed research, and there wasn't any. The fact that they added chlorophyll and cinnamon and vanilla and clove to help freshen the breath, they felt that, yeah, a little is good, a little bit more, probably a little bit better, but it just is not scientifically done. And just like people that want to cover their bad breath comes from periodontal disease. It comes from a pocket somewhere that needs to be treated. And better than that, it needs to be prevented so you never get in this situation, which can be done. Here's another product. It's made locally, no toothbrushing required, works fast and natural to help reduce plaque and tartar, a proprietary blend that they're not going to tell you what it is or how much. It just clean teeth gel. Good Buddy Bones, a delicious dental chew to help clean teeth and freshen breath. Unique texture helps remove plaque and tartar, unlike most dental chews. They are grain-free and natural. Clients like that. Smart Bones, wouldn't you like to buy something that tells you how smart you are for buying it, reduces tartar and whitens teeth, and the feline dental treats. There are so few things out there for cats. So anything that they put in a package that has a pretty smiling cat face, it's grain-free, gluten-free, soy-free, and dairy-free, promotes clean teeth and freshens breath, all natural. Wouldn't it be really nice if any of this had research behind it? And unfortunately, they don't. Now, something else to consider, and this is real important, is the product safe? You see how a dog chews. They hold, this is a stick, and the chewing is in the back of the gums there. The number one tooth breaker now are antlers, and it breaks the back premolar tooth, the upper fourth premolar tooth. And at one time, I asked clients to bring whatever they're giving their dog to chew on. These are clients that have teeth with dogs with broken teeth. I said, bring your chews because I want to see what you're giving them. And I collected them, and my collection got so big I stopped doing it. But the nylon chews are no good. Bones are no good. Anything that doesn't bend really isn't good because they will just fracture off the cusp of their teeth. So now that we know what really doesn't work, most anything that you can buy in a pet store, how do things that do work to prevent plaque and tartar work? And it's either by abrasion, which is chemical, to rub off or squeegee off the daily accumulation of plaque, or chemical, which naturally chelates or destroys the accumulation or decreases the adherence to the tooth. And your best products work on both abrasion and chemical. Toothbrushing is the gold standard. And it's a mechanical way of controlling plaque. These are Greenies is mechanical, Milkbone dental chews are mechanical, the Verbac veggie dents are mechanical. They all have chemicals in it, but their main action is mechanical. And kind of the good news about mechanical is that it really works. You know, if you eat something hard, it's going to help to rub off the daily accumulation of plaque. The bad news is that it doesn't work on teeth that, or the gum tissue, because that's the most important part of what the tooth hits the gum, where it doesn't touch the chew. So it doesn't work in those areas. Whoops. Okay, then you have chemical. So there's mechanical and chemical. Chemical is non-abrasive, and there's four basic ways. One is chlorhexidine. Chlorhexidine is a wonderful plaque control. In fact, in humans, there are only two really approved plaque control agents. One is chlorhexidine, and the other one is Listerine. And you're not going to give Listerine to a dog or a cat. The Bad news about chlorhexidine in people and animals is you have to gargle or swish it around your mouth for at least a minute. And that just is not going to happen in animals. Plus, it leaves stain with chronic use. Another chemical product is sodium hexametaphosphate, which a lot of your chews will have in them, the ones that we use chemically and mechanically, and that form soluble complexes with the calcium and plaque by ion pairing. Then there's the crystal growth inhibitors, the polyphosphates, and they wind up binding magnesium and calcium and iron found in dental biofilm. So therefore, they don't stick to the tooth, they bind and then they get swallowed. Then enzymes, that's kind of the most holistic way of treating it. This is the Bark Bright product, has the 3 different types of enzymes, and they wind up decreasing plaque just by their cleansing action. All right. Okay, so what should pet parents do? And the options that they have for home care are toothbrushing, Q-tipping, water additives, the Bright Chew, um, and rawhide chews. The water additives, and all these again are part of the solution. And if you can do them all, that would be great. Vetrodent makes this is by put out by Dectra, has a water additive um, that and an add to the water. Healthy Mouth is another product that's been around for a while. That's all natural. That's a water additive decrease. Healthy Mouth also has gels that you can apply. I'm really big on wipes. I think wipes is something that is doable, and the beautiful part of the wipes is you throw them out at the end. So this small wipe here is called the Dentacetic wipe. I like the larger ones. The MaxiGuard has a larger one, and Vetrodent has a really large one. Here's my German short hair pointer, and I'll show you how we wipe the teeth. Come all the way back on both sides, and you just have to do the outside of the teeth. If you can do the inside, that's great, but you don't have to. And we do this every night, and then we give her a chew. Okay. Dental diets are another very excellent way of helping to control plaque. The kind of good news about dental diets, they're made specially compared to a regular chew. So here's a regular little biscuit that has a little paint on the end of a screwdriver. You put it down and it lasts. The dental diets have little cross striations that when you put it into the dental chew, it takes off the striation. Toothbrushing is the gold standard. You put toothpaste, poultry flavored toothpaste, that's what they like the best, and you brush right at the gum line here. These finger toothbrushes are kind of worthless. They're rubber tips, and they just kind of burnish in the plaque into the tooth. You just don't want to do that. But why don't people brush their pets' teeth every day? And there's a good reason. They're not willing to put their hands in. And some pets aren't accept. And also, what do you do with the toothbrush? Do you put it next to your toothbrush in the bathroom? Do you put it in that drawer in the kitchen that's all sorts of dirty and dusty? And how often do you change them? I mean, ideally, you should change it every 2 to 3 weeks. But most of our clients that have used toothbrushes don't change them but every 6 months. So you're putting dirt back into your pet's mouth. So toothbrushing is just something, a great idea, but it just doesn't work out. In cats, we love Q-tips and we dip them in tuna juice. And our committed clients will take the Q-tip and go right at the gum line. And you can't use the soft Q-tips that you use on your own ears. We use the applicator stick Q-tips that have very tight tufts, and you can do with long sticks that you can direct to exactly where you are, where you want to go. And I tell them to use it like a pen. The tuna fish by itself, the tuna water, does not do anything medically. It just tastes good for the cat, and they put up with it. All right. The chews are great ideas. The Bark Bright is really cool because they've made this fun, and this is why this is a fear-free initiative. Every time I wipe my dog's teeth, she really doesn't enjoy it, but she enjoys the treat afterwards. So what Bark Bright did was incorporate a chew and a paste together. So you're actually brushing your dog's teeth without brushing your dog's teeth, without physically putting your finger in there. And you apply, they have different sizes for different sized animals. You apply the paste to the top, and then you give it to the animal. All right. So here's another type of chew, and dogs really enjoy the chews. And that's the important part, to make it fun. You want to have prevention fun and fear-free, and you don't want to have anxiety or stress involved or fear at all. You want the animal to look forward to prevention rather than it being a chore. So with all the products out there, how do you know that a product is effective? And there's an organization called the Veterinary Oral Health Council that is owned by the College of Veterinary Dentistry, the American Veterinary Dental College. It has 5 veterinary dentists, board certified veterinary dentists on staff that are all volunteers. And what they do is they evaluate how a product controls plaque and or tartar by at least, the ones that are accepted, by at least 20% in 2 independent studies. So like here's Oravet, has to be at least 20%. There are 51 dog products that have achieved VOH acceptance and 15 cat products. And they're all on the website vohc.org, vohc.org. All right, so what can the veterinarian do to help their client? Number 1 is flip the lips on every patient and incorporate plaque and calculus talk in every. Schedule professional cleaning once the plaque or calculus has reached the gum line, because right then it's gingivitis And if you can get it before it progresses to stage 2 or periodontitis, then you have a very excellent fighting chance of keeping the teeth. The key here is to keep the client compliant. Keep talking about dentistry on every visit. Prevention first. So until the dog is 6 months old, daily wipes, twice daily wipes, after a daily chew, and wipes daily. And they really, really look forward, especially if you make it fun. Your choice. All right, so you can do it. I'm here to help in any way. That's the office phone number. My cell phone number is there. And right now I'm happy to answer any questions.
Awesome. Thank you, Dr. Bellows. Our first question is, CET says it has an enzyme. Is there any chemical, tartar, or plaque effect?
Yes, the CET enzyme, it also has the lactoperoxidase, very similar to one of the enzymes in the bark bright.
Perfect. Thank you. Our next question says, with water additives, what research is there to show they are safe because of the amount that goes through the digestive system and kidneys?
The products that have VOHC acceptance are considered to be safe. The healthy mouth products that are water additives are all natural, so they are not chemical. Some of the other water additives do have chemical, and unless they have VOHC acceptance, I cannot attest to their safety.
Great, thank you. Next question is, I feel like my Clindral always wants to come back out at me. Do I need more practice?
Yes, what you need, well, I don't know if you need more practice, but the key is the dried sulcus. So Doxyrobe, I have problems letting it stick in, but the Clindarol goes in so you clean the subgingival area, and then you use your air water syringe, get it dry, and then put in the Clindarol. And a little bit is going to squeege out. That's okay. It's just going to hang out, and then it gets dissolved.
Great, thank you. It doesn't look like there are any other questions coming through, so we will wrap up. Thank you so much, Dr. Bellows. Thank you, Bark, and thank you everyone for joining the webinar today. You'll be able to find the recording of this webinar on fearfreepets.com within the next week. Thanks again and have a great day.
Thank you, Jessica. Bye now.